Part A. Extract 1. Questions 1 to 12. You hear a cardiologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. Taylor Crosswood, a cardiologist here at the clinic. I understand you're concerned about some symptoms you've been experiencing. Can you tell me what's been going on? I see. How long have you been experiencing this rapid heart rate? Has it become more frequent or intense over time?
It started about 2 months ago. At first, I thought it was just stress or maybe dehydration, but it's been getting worse. Now, even just walking up a flight of stairs can set it off. I feel out of breath and sometimes dizzy too. It's really affecting my daily life.
That sounds concerning. You mentioned hiking and exercise. Has this issue stopped you from engaging in these activities altogether?
Yes, unfortunately. I used to go hiking every weekend, but now I'm too scared to even attempt it. The last time I tried, I had to stop halfway because I felt like I was going to faint. It's frustrating because I've always been very active.
I can imagine how challenging this must be for you. Mihiraa, let's go over the details a bit more. Can you describe exactly how it feels? Is there any chest pain, shortness of breath, or other symptoms accompanying it?
Well, it usually starts suddenly, like my heart skips a beat, then it speeds up. I get short of breath, my chest feels tight, and sometimes my hands get cold and sweaty.
Have you tried any treatments?
I've tried taking deep breaths and resting, but it doesn't help much. I've even tried some over-the-counter medicines, but nothing seems to work.
Have you noticed if these symptoms occur more during certain times of the day or after certain activities? And did anything specific trigger the onset 2 months ago?
It mostly happens in the mornings, but it can happen at any time really. As for triggers, I can't think of anything specific. It just started one day out of the blue.
Understood. Let's talk a bit about your family history, Mihiraa. Do you have any family members with heart conditions, high blood pressure, or similar issues?
My father had a heart attack in his late 50s, and my grandmother had a history of high blood pressure. I try to stay healthy, but this issue has me really worried given my family's history.
That's important information, thank you. How about your lifestyle? Do you smoke, drink alcohol, or have any other habits that might affect your heart health?
I'm a non-smoker and a light drinker. I try to eat well, but I do have a lot of stress at work, which I'm sure isn't helping.
Stress can definitely contribute to heart-related symptoms. Let's proceed with a physical examination. I'll check your vital signs and listen to your heart. Your blood pressure is 140/90 mmHg, which is on the higher side, and your pulse is 105 beats per minute, which is elevated. I can hear your heart rate is indeed faster than normal. The catch is that there are no irregular rhythms, but it's important we get to the bottom of this.
What do you think it could be, doctor?
Based on what you've described, it could be a condition called tachycardia. There are several types and causes, ranging from stress and dehydration to more serious underlying heart conditions. To get a clearer picture, I recommend we conduct some tests, including an electrocardiogram, ECG, a stress test, and possibly some blood work.
That sounds like a good idea. What should I do in the meantime?
I'll prescribe a beta blocker, which can help slow down your heart rate. It's important to avoid any strenuous activities until we know more. Keep track of your symptoms, If anything gets worse, seek medical attention immediately.
Thank you, Dr. Crosswood. I appreciate your help.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Nurse Dane. What brings you in today?
Good morning. I've been feeling stressed lately, and it's starting to affect my daily life. I thought it was something I could manage on my own, but it's just not getting better.
I see. Can you describe how you're feeling now in more detail? What issues are you facing, and have you tried anything to relieve the stress?
It's been overwhelming. I feel constantly on edge, and I'm having trouble sleeping, sometimes only getting a few hours of restless sleep each night. I've been getting headaches almost every day, and my concentration at work is almost non-existent. I've tried meditation and herbal teas, and even cut down on caffeine, but nothing seems to help. The stress is making it hard to even enjoy time with my family. It's just exhausting.
That sounds challenging. When did you first notice these symptoms? Can you tell me more about how this all started?
It started about 2 months ago. At first, it was just occasional anxiety and trouble falling asleep. But then, my workload increased, and I started feeling more and more stressed. It gradually got worse. My sleep became disrupted, and I began waking up in the middle of the night, unable to fall back asleep. I think it really escalated when I missed a deadline at work, which has never happened to me before. Since then, it's like the stress just doesn't go away, no matter what I do.
Thank you for sharing that. Have you experienced anything like this in the past? Any medical history that might be relevant?
Well, I've always been a bit of a worrier, but it's never been this bad. About 3 years ago, I was prescribed citalopram for mild depression, but I stopped taking it after about 6 months when I felt better. Besides that, I've had occasional migraines, for which I take sumatriptan. I don't have any other significant health issues that I can think of.
Alright, Mihiraa. Let's start with a quick physical examination to check your vital signs. Your blood pressure is 140/90, which is slightly elevated. Your heart rate is 92 beats per minute, and your temperature is normal at 98.6 degrees Fahrenheit.
Is my blood pressure high because of the stress?
It's quite possible, as stress can definitely contribute to higher blood pressure. From what you've described, it sounds like you're dealing with chronic stress, which could be affecting your physical health as well.
That makes sense. What should I do about it?
For the time being, I'd recommend continuing with stress relief techniques like meditation and exercise, but it might be helpful to take them more seriously and do them regularly. You should also try to maintain a healthy diet and stay hydrated. Since the stress is affecting your sleep, you might benefit from a natural sleep aid like melatonin. However, this is just a temporary measure.
Okay, I can do that. But what about the long term?
For long-term management, I think it would be best to schedule an appointment with your GP. They may suggest a more comprehensive treatment plan, possibly including cognitive behavioral therapy or a prescription for something like sertraline or escitalopram to manage anxiety and depression. In some cases, a referral to a mental health specialist might be recommended as well.
Thank you, Nurse Dane. I'll make an appointment with my GP as soon as possible.
You're welcome, Mihiraa. Take care, and don't hesitate to reach out if you need any further assistance.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nursing manager called Mihiraa conducting a team meeting. Now read the question.
Team, I'm excited to introduce our new trash carts. These innovative carts are designed to improve waste management efficiency and reduce the risk of injuries. They feature a hands-free mechanism, making it easier to dispose of waste without direct contact.
That sounds great. How does the hands-free mechanism work, Mihiraa?
It uses a sensor that detects when the cart is near a trash bin. The lid automatically opens, allowing you to dispose of waste without touching it.
That's fantastic. This will definitely help prevent the spread of germs and reduce the risk of infections.
I'm concerned about the durability of these carts. Mihiraa, will they be able to withstand heavy use?
The carts are made from sturdy materials and are designed to be durable. We'll monitor their performance and make any necessary adjustments.
Now look at question 26. You hear a care home manager called Mihiraa talking to a newly admitted patient's GP. Now read the question.
Dr. Paul, thank you for referring Mr. George to our care home. We've reviewed his medical history and medication list. I have a few questions about his medications.
Please go ahead, Mihiraa.
George is currently taking a combination of medications for his heart condition and diabetes. I noticed that he's also taking over-the-counter pain relievers. Is there a specific reason for this?
He's been experiencing some discomfort in his joints lately. I recommended over-the-counter pain relief as a temporary measure.
I see. We'll monitor his medication closely and ensure there are no interactions. It's important to avoid unnecessary medications, especially in older patients.
Absolutely. I'll review his medication regimen and make any necessary adjustments.
Also, I noticed that George is taking a blood thinner. We'll need to be cautious about any potential bleeding risks, especially during minor procedures.
Thank you for bringing that up. We'll provide detailed instructions to the care staff regarding his medication and any precautions necessary.
Now look at question 27. You hear a GP called Mihiraa talking to the staff in the clinic. Now read the question.
Team, I'm excited to introduce our new token system for patient appointments. This system aims to improve efficiency and reduce wait times for our patients.
How does the new system work, Dr. Mihiraa?
Patients will receive a numbered token upon arrival. The tokens will be displayed on a screen, and patients can wait in the designated area until their number is called. This will help us manage the patient flow more effectively.
Will this system eliminate wait times completely?
While we can't guarantee zero wait times, the token system should significantly reduce them. It will help us prioritize patients based on their appointment times and medical needs.
Dr. Mihiraa, what happens if a patient arrives late for their appointment?
We'll have a policy in place for late arrivals. Patients who are significantly late may need to reschedule their appointments. However, we'll try to accommodate them if possible.
Now look at question 28. You hear a head nurse called Mihiraa talking to a staff nurse. Now read the question.
Nurses, it's important to emphasize the consequences of taking uninformed leave. While we understand the need for time off, it's crucial to follow the proper procedures to ensure adequate staffing levels and patient care.
I understand, Mihiraa, but sometimes unexpected situations arise that require last-minute leave.
That's true. However, it's essential to notify your supervisor as soon as possible. This allows us to plan and adjust staffing accordingly.
What are the consequences of taking leave without informing the supervisor?
It can lead to staffing shortages, which can impact patient care quality. It can also result in disciplinary action, including written warnings or suspension.
Can we take leave if we're feeling unwell?
Of course. If you're sick, it's important to prioritize your health and avoid spreading illness to patients and colleagues. However, please notify your supervisor as soon as possible.
Now look at question 29. You hear a dentist called Mihiraa talking to a surgeon. Now read the question.
Dr. Paul, I'm concerned about Mr. Gill's recovery following the recent jaw surgery. He's been experiencing significant pain and swelling.
Yes, Mihiraa, that's not uncommon after such a procedure. The swelling is likely due to inflammation. It should subside over time.
I'm also worried about the potential impact on his oral health. The surgery could affect his bite and dental alignment.
That's a valid concern. We'll need to monitor his bite and make any necessary adjustments to his dental restorations.
Additionally, I'm concerned about the risk of infection. Given the location of the surgery, there's a higher risk of oral bacteria entering the wound.
Absolutely, Mihiraa. We've prescribed antibiotics to prevent infection. It's important for Gil to follow the medication regimen carefully and maintain good oral hygiene.
I'll ensure he's aware of the importance of postoperative care and provide him with specific instructions.
Now look at question 30. You hear a nurse called Mihiraa talking to a physiotherapist. Now read the question.
Evan, I'm concerned about Mr. Paul's progress after the knee replacement surgery. He's having difficulty walking without assistance.
Yes, Mihiraa, it's normal for there to be some mobility limitations initially, but we need to assess if there are any underlying factors hindering his recovery.
I've noticed he seems a bit hesitant to put weight on his knee. Is he experiencing any pain or discomfort?
Let's check his wound and see if there's any inflammation or infection. Sometimes, these factors can limit mobility.
He mentioned feeling a bit dizzy when standing up. Could that be related to his medications?
It's possible, Mihiraa. We should review his medication list and see if there are any side effects that could cause dizziness.
I'll inform the doctor about his symptoms. In the meantime, we can focus on strengthening his leg muscles and improving his balance.
That's a good plan. We can start with gentle exercises and gradually increase the intensity as he improves.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a geriatrician, Dr. Mihiraa, and an interviewer.
Good morning, Dr. Mihiraa. First, let me congratulate you on reaching a significant milestone in your career, 25 years in the field of surgery. Let's begin with a fundamental question that many might overlook in its simplicity. Could you explain, in your own words, what it truly means to be a surgeon?
Thank you. It's a pleasure to reflect on my journey. At its core, a surgeon is someone who intervenes in the most direct and invasive manner to correct, heal, or improve the human body's condition. But it's more than just the technical aspects of cutting, suturing, or removing tissue. Surgery is about decision-making under pressure, understanding the intricate balance of human physiology, and sometimes having to choose between several difficult options, all with profound consequences. A surgeon is an artist who sculpts with precision and a scientist who must constantly be updated with the latest advancements. The role demands both unwavering confidence and humility, for we deal with the most precious and fragile entity, human life.
That's an insightful perspective, Dr. Mihiraa. It's clear that the role is multifaceted and requires a deep commitment. Let's take a step back to the beginning of your career. Can you share some memories from the initial stages of your career and the challenges you faced during that time?
The beginning of my career was a blend of excitement and uncertainty. Fresh out of medical school, the sheer weight of responsibility that comes with being a surgeon felt immense. I recall the first time I assisted in a major surgery. The lights of the operating room, the sterile environment, and the focused, almost palpable tension were overwhelming. In those early years, one of the greatest challenges was the constant fear of making a mistake. Surgery is unforgiving. One wrong move can have catastrophic consequences. I spent countless nights studying and restudying procedures, anatomy, and case studies to ensure I was as prepared as possible. However, knowledge alone wasn't enough. The physical stamina required was also a challenge, long hours in the OR, sometimes standing for 12 to 14 hours without a break. Yet, despite these challenges, the joy of a successful surgery, where a patient's life was significantly improved, kept me going.
Your dedication during those early years is truly commendable. Moving forward, as you gained more experience, you must have encountered complex cases with significant treatment challenges. Dr. Mihiraa, how did you navigate and overcome these hurdles?
Indeed, every surgeon, no matter how experienced, encounters cases that challenge their skills and knowledge. The most difficult situations are often those where the best course of action isn't immediately clear. I remember a particularly complex case early in my career, a young patient with a rare congenital heart defect that required innovative surgical intervention. The stakes were incredibly high, and the surgical plan was fraught with risks. In such situations, I learned that collaboration is key. I consulted with colleagues from different specialties, and we brainstormed multiple approaches before deciding on the best one. Additionally, I've always believed in the importance of staying calm under pressure. When you're in the operating room, the clock is ticking, and the patient's life is in your hands, panic is your worst enemy. Over time, I developed mental strategies to remain focused, breaking down the surgery into manageable steps and visualizing each one before making a single incision. This methodical approach, combined with a willingness to seek advice and a deep respect for the complexity of each case, has been crucial in overcoming treatment challenges.
It's fascinating how you've managed to maintain such composure and methodical thinking under pressure. Surgery, as you mentioned, is an incredibly high-stakes profession, which undoubtedly leads to personal stress. How have you managed to balance this stress over the years, Dr. Mihiraa?
Balancing the stress that comes with surgery has been one of the most challenging aspects of my career. The nature of the work means that you carry a significant emotional burden. Every patient's outcome weighs heavily on you. In the early years, I struggled with this immensely, often finding it hard to disconnect from work even when I was at home. I realized that to sustain a long career, I needed to find ways to manage this stress effectively. One of the strategies I adopted was compartmentalization, learning to mentally separate work from personal life. This allowed me to be fully present with my family and friends, which was crucial for my mental well-being. Another approach was maintaining a strong support network of colleagues who understand the unique pressures of the profession. We would debrief after particularly tough cases, offering each other support and perspective. Physical activity also became a critical outlet for stress. I took up running and yoga, both of which provided not only a physical release, but also mental clarity. Over time, these strategies helped me develop resilience, enabling me to handle the intense stress of surgery without it overwhelming my personal life.
Your resilience is truly inspiring, Dr. Mihiraa. It's clear that you've learned a great deal over your 25 years in the field. If you had to distill your experience into a single, overarching lesson, what would that be?
If there's one lesson that stands out above all others, it's the importance of adaptability. Surgery is a field that is constantly evolving. New techniques, technologies, and understandings of human anatomy and disease emerge all the time. As a surgeon, you cannot afford to be rigid in your thinking or approach. You must be willing to learn continuously, unlearn outdated practices, and embrace new methods, even if they challenge your long-held beliefs. Early in my career, I was somewhat resistant to change, preferring to stick to what I knew. But as I gained more experience, I saw how this could limit my effectiveness. Adaptability isn't just about adopting new surgical techniques, it's also about being open to different ways of thinking and problem-solving. It's about listening to younger colleagues who might have fresh insights, or reconsidering a treatment plan when new information comes to light. This mindset of continuous learning and flexibility has been the most valuable lesson of my career, allowing me to grow not just as a surgeon, but as a person.
Adaptability is indeed a powerful lesson, and it's evident that it has served you well. As you look forward to the future, with 25 years already behind you, how do you feel about reaching this milestone and potentially looking ahead to 30 years or more in your career?
Reflecting on 25 years, I feel a profound sense of gratitude for the opportunities I've had, the patients whose lives I've touched, and the growth I've experienced both professionally and personally. Reaching this milestone has also given me a deep appreciation for the journey itself, with all its ups and downs. Looking ahead to 30 years or more, I'm filled with a sense of renewed purpose. The field of surgery continues to evolve, and there's still so much to learn and contribute. I'm excited about the future, particularly with the advancements in minimally invasive techniques, robotic surgery, and personalized medicine. These are areas I'm eager to explore further. Moreover, as I advance in my career, I see the importance of mentoring the next generation of surgeons. Sharing the knowledge and experience I've gained is a responsibility I take seriously, and I look forward to helping young surgeons navigate the challenges of their own careers. Ultimately, while the past 25 years have been incredibly rewarding, I believe the next chapter holds even more promise.
Now look at Extract 2. Questions 37 to 42. You hear the President Dr. Mihiraa talking about the latest architectural blueprint for the Mihiraa Research Center. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. It is a pleasure to be here today to discuss the latest advancements in stress management and coping mechanisms that we have developed at the Mihiraa Research Institute. As we all know, stress is a pervasive issue that affects millions of people worldwide, influencing both mental and physical health. Our institute has been at the forefront of psychological research, striving to find innovative solutions to help individuals manage stress more effectively. Today, I will guide you through our strategic plan, how it was meticulously crafted, its profound impact on the field, its methodical implementation, the future scope of our research, and the reliability of our findings. At the Mihiraa Research Institute, our plan to tackle stress and coping mechanisms is rooted in a multidisciplinary approach. We recognized early on that stress is not just a psychological phenomenon, it is deeply intertwined with physiological processes and socio-environmental factors. Therefore, our plan encompasses research into cognitive behavioral techniques, neurobiological interventions, and even the role of social support networks. The core of our plan involves integrating these diverse aspects into a cohesive model that can be tailored to individual needs. The plan was developed in phases, beginning with an extensive literature review to identify gaps in existing research. This was followed by pilot studies that informed the broader strategy. The plan also incorporates a robust feedback loop, allowing us to continuously refine our approach based on real-world outcomes. The development of this plan was a complex process, necessitating collaboration across various domains of expertise. We assembled a team of psychologists, neuroscientists, sociologists, and data scientists to contribute their unique perspectives. One of the key challenges we faced was ensuring that our approach was both comprehensive and adaptable. We began with a series of workshops and think tanks, where experts discussed the latest findings in their respective fields. The insights gathered from these sessions were then synthesized into a working framework. This framework was subjected to multiple rounds of peer review and refinement. The final plan was not just a theoretical construct, but a pragmatic guide, with detailed protocols for implementation at different stages. An interesting aspect of our process was the use of predictive analytics to anticipate potential challenges and outcomes, allowing us to fine-tune the plan before its implementation. The impact of our plan has been significant, both within the research community and in practical applications. Our integrated model has redefined how stress and coping mechanisms are understood and treated. Traditionally, stress management has focused on either psychological or physiological interventions in isolation. Our approach, which considers the interplay between mind, body, and environment, has opened new avenues for holistic treatment. In clinical settings, patients who have undergone interventions based on our model have shown marked improvements not only in reducing stress levels, but also in enhancing overall well-being. On a broader scale, our research has influenced policymaking, with several health organizations adopting elements of our model into their public health strategies. The impact extends beyond individual outcomes, as our research has also contributed to a shift in how stress is perceived in society, emphasizing resilience and proactive coping. Implementing our plan was a meticulous process, requiring careful coordination across multiple fronts. The first step was to pilot the plan in controlled environments, such as clinical trials and specialized therapy programs. These pilots provided valuable data, which we used to refine the intervention protocols. Following the pilot phase, we initiated a broader rollout, targeting diverse population groups to test the adaptability of our model. This phase involved training practitioners in the new methods, ensuring they understood the underlying principles and could apply them effectively. Another critical aspect of implementation was monitoring and evaluation. We established a robust system for tracking patient outcomes, practitioner feedback, and overall program efficacy. This data-driven approach allowed us to make real-time adjustments, ensuring that the implementation remained aligned with our goals. The challenges we encountered during this phase were addressed through adaptive strategies, such as adjusting intervention intensity based on individual responses. Looking ahead, the future scope of our research is vast. One of our primary goals is to expand the application of our model to different population groups, including those with chronic health conditions, adolescents, and elderly individuals. We are also exploring the integration of technology into our interventions, such as the use of AI-driven tools for personalized stress management plans. Another exciting avenue is the potential for our research to influence workplace wellness programs, where stress is a major concern. Furthermore, we are committed to advancing our understanding of the neurobiological mechanisms underlying stress and coping, which could lead to the development of more targeted interventions. We also aim to collaborate with international research bodies to ensure that our findings have a global impact. As we move forward, continuous innovation and rigorous testing will be key to expanding the reach and effectiveness of our stress management strategies. The reliability of our findings is a cornerstone of our work at the Mihiraa Research Institute. We have employed rigorous scientific methods to ensure that our research is both valid and reproducible. Throughout the development and implementation of our plan, we have maintained strict adherence to ethical standards and methodological rigor. All our studies have undergone thorough peer review and have been published in reputable journals, further validating our approach. Additionally, we have conducted longitudinal studies to assess the long-term efficacy of our interventions, which have consistently demonstrated positive outcomes. We also recognize the importance of transparency in research, and all our data and methodologies are available for scrutiny by the wider scientific community. This commitment to reliability not only reinforces the credibility of our work, but also ensures that our findings can be trusted to guide future research and practice in the field of stress management.
That is the end of your OET listening test. Now check the answers.